All right, hello. My name is Dr. Todd Molsky, and I am your presenter today. It is going to be about an hour or so, maybe about 75 minutes going through this. Lots of information. I'm going to go real fast, so let's get into it. All right, we're going to talk about regenerative medicine. This is a new solution for you. You are and should be very excited about regenerative medicine as we are. I'm going to tell you all about this. You are going to be an expert in regenerative medicine by the time you're done with this seminar, and probably know more than your regular medical doctor does about regenerative medicine. So let's get into it. Today is a exciting day because you have a chance to really not only feel better, but break that cycle of pain, get your life back. It is an opportunity to change your whole life. So let's talk about it and get started. A whole lot going on here. I'm going to talk real fast. There's lots of information. I want to make sure that's okay. I want to make sure that you understand that I am really passionate about this. And so if my voice goes up and I start to kind of almost yell, don't worry about that. I'm not yelling at you, but I do get passionate about the subject. So the last thing is I want you to take notes today because, like I said, you're going to be really knowledgeable after this. But I also want to help you make some decisions so that way you can get the help that you want. All right, so here we go. Let's talk about me just real quick. I am a wellness consultant. I work with the nonprofit, the Foundation of Wellness Professionals. I'm a referring practitioner with the Cancer Treatment Centers of America. I'm also board certified chiropractor here in Texas. And I'd say about 2010, I was really feeling strapped. I've been in practice. This is going on 20 years plus. But in 2010, I felt like I was being shackled in my practice. And the big thing was that people were going over to see me, to see the chiropractor. They were going over to their medical doctor. They were going over to the physical therapist. They were getting conflicting things that were going on, and I felt really bad and really bad for the patient, for you, because most of the practitioners, they were butting heads. And it was horrible. I couldn't stand that anymore. So what I did was I really wanted to basically take all those people and put them all together. So we did that at Freedom Health Centers. We have medical doctors, nurse practitioners. We have chiropractors and chiropractic assistants, physical therapist assistants, massage therapists, nutrition specialists, and weight loss consultants, all under one roof. So we took all those great aspects of everything and basically, about 2012, as my medical director came to me and said, "Hey, man, you need to look at this." And it was the regenerative medicine aspect, stem cells and PRP and those kind of things. And we started digging into it. We took about 3 years. We dug into it. We really said, okay, we're gonna study this real well. We're gonna get a good background in this. We want to find out and get all the best information we could, and that's what I'm going to present to you here today. A good 3 years of study out of myself, engaging in all this, and working with people on regenerative medicine. So it is time to be excited. Time to be excited. This is our medical director, Dr. Sutherland. He is a medical doctor, board certified anesthesiologist. He has got the vision of this. He basically said, you know what, I'm an anesthesiologist, I'm a pain medicine doctor, and that doesn't work. And so he basically said, I'm going to look into all this stem cell work, and he started doing that, and we joined forces, and it's been tremendous. We have seen a whole lot of great results and different things I'm going to talk to you about, but he's actually in a fellowship program in regenerative medicine, and just an overall great guy. So Dr. Sutherland is a great resource for this. But our purpose at Freedom Health Centers is really we want to look and find those 3 overlooked causes. There are 3 main causes that are totally overlooked that I find that our team has found over the years, and that is Really, when you get to the roots of things, they're how people eat, how people move, and how people think. Those are the three overlooked causes. How you're feeding your body is a hugely important thing. If you're feeding it not so great stuff, you're not going to get so great of results. You're feeding it good stuff, you're going to get good results. But even the person who they get a diet of all organic, all real clean foods and all that stuff, it is proven that they even need supplementation. So our soil is terrible. It is what it is. We live in the United States and everything's fast, right? Fast food and all those kind of things. We want it quick, but the body doesn't like that so much. So we need to look at eating well as a big thing. Moving well. What do we do all day long? What do most people do all day long? Well, that's sit. You're sitting in front of your computer right now looking at this. It is a hugely overlooked thing. That my motto is sitting to the spine is like sugar to your teeth. We all know what sugar to your teeth does, is rots them away. Well, sitting rots away your spine. Really, really important thing and majorly overlooked. A lot of us now are weekend warriors, and we tend to get the issues with weekend warrior things. And so we're going to really talk about that as we go on, and movement and those kind of things. But exercise is a big thing. We need to really work on those areas that need the work there in terms of your physical body. So how you eat, how you move, and the last one, which is, I think, probably one of the most important ones, if not the most important, and that is how you think. How you think sets up everything. It sets the tone for everything. Because how you think about your healing is a big thing. Because if you go into a doctor's office and you don't feel that that person can help you, it is really doubtful you're going to get help. It really is. Your mindset has to be really sharp in terms of how you're going to heal. And so we want to make sure that we're providing those things, and we're looking at all those things in our office. So we want to help to improve not only how you eat, but how you move and how you think. So the three overlooked causes there are very important. We see people from the North Dallas area and all throughout Texas. We do see people come into us from surrounding states. I had a lady who came down from Kansas a little bit ago, and she got her stem cell both knees, and we were talking and basically found out that she was on her way back there. She was able to do squats and doing things like that, in her 70s. And we were just like astonished when she could barely get up and down stairs and those kind of things. And she got the exercise things that she needed there in Kansas, but the stem cells really just changed her life. Amazing stuff. People come to us because of the results that we get. You can go to our Google page and Google us, Freedom Health Centers, and you'll pull up and you'll see all the different areas that we can help with, and you'll see a bunch of reviews on there, and you'll see all kinds of stuff. But all those reviews are huge, and so there's a lot of them. Go check it out. People come to us for the results, but they stay with us because we care. That is the biggest thing. I really wanted to make sure that we have a staff of really caring people, and we do. And so it not only starts from the front desk, but goes back through the medical team, the chiropractic team, the physical therapy team, massage therapists, nutritionists, all those things. So we have a hugely caring office, and we are excited about that. And really, people understand when they come to us that we are authorities. We are authorities on regenerative medicine. We are authorities on chiropractic, on physical therapy. We have a great weight loss program that is unbelievable. So we have authority in these things, and we want you to know that we know what we're doing, and that is why we get the results that we do. So that is our purpose there at Freedom Health Centers. Let's jump into how this goes. Now, I can show you and talk to you all about the anatomy and the physiology and all those kind of things, give you a whole lecture on like a medical school type of thing. But I find that to be kind of boring and really kind of too in depth and too over the head for a lot of people. So what I like to do is use analogies. And the first analogy is this. This is a picture of what? A nice tire on a car, right? Brand new tire, looks great, and is great functioning, right? But over time, we tend to get a tire that kind of looks like this. And how does this happen? Of course, this is a picture of a worn out tire, but how does this happen? It happens because of the alignment issue. The alignment is what causes this to occur. It's just like any joint, and I'm going to show you, I'm going to go through all the different joints that we see and how we get the wear and tear that goes on. That is the osteoarthritis that happens in the joint is because of the misalignment that occurs. It's the wear and tear that occurs, okay? And so when we see this, is what I don't want to do is I don't want to just take off this tire and put on a brand new tire. That would be great for a little while. It would. But what would happen to that tire if you didn't change the alignment? It would end up looking just like this. So we gotta make sure, gotta make sure that we change the alignment and the function of your vehicle so that way that doesn't occur again. Okay, so very, very important. This is how we do that. This is fuel, form, and function. We've got to make sure that you're fueling your body right, because if you are getting regenerative medicine, if you are getting things like stem cells, PRP, those kind of things, you want to make sure that works really, really well. And the way you fuel your body has a lot to do with that. So making sure that we're fueling it correctly with good food, good supplementation, those kind of things is important. Your form, how your body is formed, the alignment of your body, how your muscles are functioning, and those kind of things move into the function. But the function is controlled by one master system, and that is your nervous system, right? Your brain has to tell your body what to do. And your body then in turn tells your brain what's going on. So your fuel, form, and function are all linked together, and especially linked together through that nervous system. So making sure that it works well is important, very, very important. So we always want to make sure that we're working with fuel, form, and function, okay? So let's talk about it. Degenerate means to become worse over time, right? And degenerative diseases are those health problems which will get worse without proper treatment. We know that as degeneration starts, is that if it isn't changed, if something isn't changed in how that function is going on, it is going to get worse. Now, some people may think, oh, they've got a genetic problem and those kind of things. Well, you weren't degenerative as a kid, were you? Let that sink in a little bit, because some people think, oh, mom had degenerative disease and so that makes me have it. Not necessarily. You can be a little more predisposed to it if you don't do things right, but you've got to make sure that you're functioning as best as possible. So degenerative disease is important if you don't get the proper, is not good if you don't get the proper treatment. So let's make sure we understand that. Here is a progression of a knee joint. On the left, there's your normal knee joint. Up the top there's your femur bone, and the bottom big bone there is your tibia. The little bone on the outside left there is the fibula. The thing we're looking at is that space where those arrows are pointing to. That space is very, very important. Those little nubs in the middle there, that's the horns where your cruciate ligament's attached to. So that's normal in there. But the space, you can see how equal the space is on each side. If you go to the right-hand picture there, well, that's an arthritic knee joint. You can see how less space there is there. You can see off to the left side there where the bone is actually starting to kind of lip out. That's called an osteophyte or a bone spur. And when all that occurs, you're going to have inflammation. And all that inflammation leads to pain. And and that's where we get that pain from. So that is a progression. Remember, it doesn't go from just that left one to the right one. It doesn't. There's a progression that goes along with that, right? So it's not going to just change from a normal joint to an arthritic joint. It's going to change like that over time, just like the tire does in the picture that we had before. It goes from a new tire, and then it starts to wear and wear and wear, and then we get that totally worn out tire. Okay, so that's a knee joint. Here's a low back. This is a picture of a low back from the side. This is a person, if you were looking at them, they're standing facing to the right. Down the bottom there's the tailbone. You can see all the individual kind of cubes or squares. Those things are your vertebrae. The spaces in between those are where your discs are. And you can see all those on the left-hand picture nice and equal. And then on the right, not so great, especially looking at the bottom ones there. Those spaces in between the bones, not so good. You can see the big lip things coming off the front. Those are those osteophytes or those bone spurs that occur. That is the degenerative lumbar spine. Here is a hip. Normal hip. This is looking at the picture on the left, the normal space there. You can see the head. Remember from high school probably, you remember the hip is a ball and socket joint. You probably heard of that. You can see the femur bone there, and where it says the normal joint space, you can see the ball, and then the socket is on the pelvis there, and that space in between is the normal joint space. When you see it on the right picture, yeah, that space is lost. The wear and tear that's going on, the bone spurring that's going on, not so fun. Here's a shoulder. When I describe a shoulder, I always describe it as a ball in a teacup. Just like we talked about with the hip is a ball and socket, well, this is a ball in a teacup. And of course, a ball can kind of float around in a teacup. The shoulder is mostly held together by muscles and ligaments. And so as the shoulder is that it is a very, really a very mobile joint, which creates really a whole lot of instability in the joint. People can have a lot of issues with that in what goes on. And so as the progression goes on, the wear and tear, you can see the joint space starts to close down, and you get bone spurs and not so fun in the shoulder joint. And we get, of course, lack of mobility. Remember that problems get worse over time. Unless you try something new, your problem will not go away on its own. Remember the old adage that doing the same thing over and over and expecting a different result, that's the definition of what? Insanity, right? So we got to make sure that we are doing something new to the problems that are going on here, because especially if something has not gotten better in what you're doing, that means that the cause hasn't been found yet. All right. So remember that problems do get worse over time. So before we look at solutions for you, I'd like to look at a survey here, and the survey is this, and you can take a look at this survey here. We're going to go through this. We go through this in our live seminars a whole lot, but you can take a look at that survey there. Basically, at the top, it's going to have name and all that good stuff. That's so that way we can really make sure that we're sending you a bunch of emails and things like that. No, just kidding with you. It's that way we can get you things like an ebook and make sure that you have even more ammunition and more information on regenerative medicine. But in the middle there, it talks about pain in things like your shoulders, knees, and hips and ankles and all the different things. Decreased motion. You know, people come to see me and see our team, and they have, they may have pain in one joint, but they may not have pain in another. But there's a lot of degeneration that's going on in that joint, and yet they have what tends to be more of a real indicator of degenerative joint disease, and that is decreased motion. Decreased motion the motion is really affected by the osteoarthritic changes. Of course, swelling can go on, and then other problems, because people may come, and you may be listening to this is you don't have any of those problems, but maybe there's problems with weight or diabetes or digestive issues, dizziness, those kind of things. And Fatigue is a huge one. I mean, across the board, people have all kinds of fatigue and sleep issues and things like that. If you do have one of those problems, or your spouse is sitting there with someone else and you have those problems, know that there are solutions. There are solutions to that. All right. So as we go through and we fill out that survey, we want to make sure that we have that information so that way we can call you about gift, and that is our ebook. And we only can know what's going on uh, when we know the extent of your problems. So knowing those things is important, and coming in and doing an evaluation with us, that helps us get and find the root causes of the problems that you do have. So a lot of people come in with knee problems. When somebody comes in with a knee problem, is one of the major issues that people have is that they can't get up and down stairs. That seems to be one of the biggest problems. And I can't even imagine, somebody has a knee problem, they can't get up and down stairs, and yet they have stairs in their house. How do they even access their own home? It's terrible. Most people with knee problems like this, osteoarthritic changes in the knee, they avoid stairs. They avoid them as much as they possibly can. Getting in and out of a car, picking up kids, grandkids, those kind of things, really a problem for the person with the knee problem. Shoulder problems, lifting your arms above your head, playing ball with the kids, even reaching up to get a glass or a plate out of a cabinet is difficult for those people who have shoulder arthritic changes. Hips, of course, walking, just in itself is a huge problem. Ankles, feet, elbows, wrists, hands, and of course the spine, where a majority of that stress goes into. There are solutions for these things. The biggest question on our survey, and this is where you have to look at that, is I need you to make sure that you are understanding of what you cannot do now or can't do as well now because of your pain, because of your osteoarthritic changes that are going on. What can you not do or not do as well now that you could do before? Really think back on that, because this is what it's about. This is your life. Man, I used to be able to play golf, and I could go 18 holes every day if I wanted to. Now I can barely make it through 9. Maybe it's picking up the grandkids, or playing ball, or going on a walk, doing exercise that I used to love to do. I used to go love and jog to jog, and now I can't do that as well. Those are the most important things, because that's your life. That's what we want to help get you back to, at least to some extent of that, because that's joy, and joy is what we need in our lives. So really think about that and answer that question. Remember that you've probably seen that light that comes on in the car, that check engine light. You could do something, you have choices when that light comes on. You could sit there and go, wow, that light came on. So what I'm going to do is take a picture of my spouse or my grandkids or whatever. I'm just going to stick it right over that light. Light's gone. No more light. Or I could actually go, oh boy, I got to take that thing and get it changed, get it checked out, and then fix the root problem of that, right? So today's society, we tend to mask it, and we're going to talk all about that here coming up. So let's make sure that we understand. Let's not just mask the problem. Let's get to the root of it and let's fix it. So what are the options available? Let's go back to some of the old options. Non-steroidal anti-inflammatory drugs, right? You can go to Costco and buy a huge tub of Advil for about $30. The thing is that these things, they don't fix a thing. They really don't. They don't fix anything. They may mask some pain. They may take some pain away, but they don't fix the actual problem. And that therein lies a huge problem, because when you're feeling okay and your problem is still there, that damage continues and even gets worse. And you can do that with prescriptions. They take the Advil and ramp it up on you, right? Again, not changing anything and not doing anything to improve that degeneration. Opioid drugs, wow, this is a big one, right? This is huge in the news these days because of all the things that go on with these drugs. Now killing nearly 1,000 people a week. By the time we get through with this slideshow here, you got to know that 2 people have died because of this. It's terrible. More people are killed by these things than auto accidents. Horrible type of drug. Cortisone, I tell you, this is a big one. I'd say 4 out of 5 people who listen to this, they have had a cortisone injection already. Those cortisone injections, and 4 out of 5 people who get a cortisone injection feel great. They feel great pretty quickly. They may even go year, 2 years or whatever without having to change or having to do anything about their problem. And that then it comes back, and then they go, oh man, I just need to go get another cortisone injection. They get it, oh, man, I feel good. And then it's like, 3 months, 6 months later, it comes back. Go get another one. Then it's like a month goes by. So there's decreasing return on these things. The biggest problem with this stuff, what is cortisone, right? What is it? Cortisone is a steroid, right? And what do steroids do? They take care of inflammation. Therein lies the big problem, is they take care of the inflammation, but it doesn't take care of what caused the inflammation. That's the key. You got to get to the cause. The other thing is they don't tell you about the things that it does other than that. Cortisone causes an 8% bone loss. They don't tell you about that, do they? Osteonecrosis, osteoporosis, tendon ruptures. It also helps, it diminishes your immune system. There's all kinds of things. You can look at, if you get a cortisone injection, they're supposed to give you a booklet on it, but you have to get out your magnifying glass to take a look at the side effects of it. They really don't tell you about it, but these are things that occur. You can Google this stuff. It's there. It's common knowledge of what this stuff does. So again, but it's not changing and fixing the root cause of it. So as a result, people taking drugs for pain may continue to injure themselves even if they do not feel it. You'll feel better today with those type of drugs, but will actually be worse tomorrow. Oh yeah, surgery. That's generally the next step for a lot of people, and they go through all those kind of things as they go into surgery. Pain, of course, comes about with surgery. I just go to YouTube and YouTube a total knee replacement. You probably won't get through the whole video because it's pretty bad, but there's many of them out there showing total knee replacement surgeries. 3 to 6 months of healing and rehabilitation time. Not a lot of doctors even send for rehab after a total knee replacement. Pretty bad there. No guarantee of result. High percentage of failures and complications. We see a ton of complications come in with these things. 50% more will need additional surgery. That is a huge statistic. You get a total knee replacement, you have a 50% chance there of having additional surgery. Total cost for a total knee replacement, $55,000. Comes out of deductible. You do have to pay for these things and how it goes, but that's uncomplicated. So what is your cost? The lost time, the function, the pain and suffering that you go through because of these things. Had a lady come in, she had double knee replacement twice, and she still had pain. And I was just, I can't do anything about that because there's no joint there to actually fix. It's horrible. I really felt for her and what we could do. We worked on some other things, but man, scary stuff. Journal of Orthopedic Medicine, the risk of surgery, bleeding problems, blood clots. What's the bad thing about a blood clot? Yeah, death. That's a bad thing. Infections, 4 in 100 will have an infection. What's the bad thing about infection? It's called sepsis and death. That's another bad one. 1 in 400 after a total knee replacement within 30 days dies. 1 in 400. I don't want anybody to have those odds. That's terrible odds. Hugely, just a huge odd of death. Not good. Of course, the increase of narcotics and opioids and NSAIDs and muscle relaxers that come about afterwards, and all the issues that go on with those things. Surgery, not sure of a great outcome with that, right? So I love this little cartoon, and we've exhausted all conventional measures. One last desperate option is to put you on alternative natural medicine that has a 96% success rate. Pretty funny. This is our different protocols that we have here. We call them the Advanced Arthritis Relief Protocols, and especially with the knee, which is very important. Hyaluronic acid, some people may know what hyaluronic acid is, and they may have done these things. These things are hyaluronic acid. For lack of better words, I call it snot. It's a snot for the joint. It acts as a natural shock absorber and lubricant within our joints, and you can inject it. Suparts, Genvisc, Orthovisc, these are all different types of products that are available. We can replenish the natural hyaluronic acid, and that can slow and stop, and some cases could reverse. But this is somebody who has low end degeneration in maybe phase 1 at most. Is where this tends to work pretty good. So hyaluronic acid is a viable option for some people. Some people, if they're further along, it's not the greatest. It's just more of the Band-Aid type of thing. So we don't want to do that. We want to look at regenerative medicine. And regenerative, that means to bring into existence again, right? Is that we can help not only eliminate pain, but repair and rebuild and heal those areas that are injured in your body. Amazing, amazing stuff. Let's talk about that. You know, if a lizard loses their tail, it grows back, right? That's what we mean by regeneration. In your body, you do have the ability to regenerate. There are certain organs that do that very, very well. The liver is one of them. Do you know why the liver regenerates really well? Well, I do. I'm going to tell you. It's because there's a lot of blood flow in the liver, right? The liver is your filter. Filters out all the different toxins and things that are going on. And so all the blood has to pass by through there. So it has a lot of blood vessels that are going on in it. The cool thing, what hangs around blood vessels? Stem cells. Stem cells are called pericytes. They hang around those blood vessels. So if they're damaged, they can go right to work. Really, truly amazing. What type of tissue doesn't have a lot of blood vessel? You guessed it, your joints. Not a ton of blood vessels that get in there, especially into the knees. Very, very important to know. Everybody's researching this stuff. I'm telling you, it is it is the next step in medicine. It is going to be incredible. And it is incredible right now because we're seeing just unbelievable results with these things. 90% and above success rate with people getting great results with it. So regenerative medicine offers a way to eliminate degenerative disease related to pain. So you have two choices. Remember, you can do the same thing over and over, expecting a different result. That's called insanity. You can be insane, or you can try something new. This is the new thing. Okay. Regenerative medicine at our facility, we offer two basic types of regenerative medicine solution, your platelet-rich plasma injections and your mesenchymal stem cell injections. That is through your amniotic membrane allograft and your umbilical cord plus the amniotic membrane allograft. We'll talk about those. So I'm going to tell you all about that and how that goes. PRP, platelet-rich plasma. Amazing, amazing stuff. This is where we're going to take your blood and we're going to spin that blood down, and we're going to get those platelets off of that blood. What do platelets do? right? They are the clotting factor. That's what most people know. But one of the things they also do is after that, they've helped clot, they explode and release a lot of growth factor. So they are able to start that healing cascade. PRP has several different growth factors and cytokines, which are the foreman of the cells. They tell all the different cells what to do, and that stimulates healing of soft tissue such as muscles, ligaments, and tendons. How does it work? Again, we're gonna take the blood, we're gonna centrifuge that down, or we're gonna trap the PRP. We combine it with another growth factor, what's called accelerate GF or accelerate growth factor, and that is a wonderful ability then to get into that tissue and start to rebuild that process. The PRP will have those natural growth factors, but it also recruits your body's own stem cells to the injured area, which is great. So there's pictures of what we do. We can get the blood there. Before separation, we separate it out and take the plasma off of that. Common uses for the PRP therapy: osteoarthritis is a common use. Rotator cuff tears and strains and those kind of things. ACL injuries, pelvic pain, back, neck injuries, tennis elbow, golfer's elbow, all the different tendinitises, chronic knee pain, muscle strains. Wonderful, wonderful for soft tissue use. How do you know if PRP is right for you? If you got pain lasting 3 months or longer, you got sprains, strains, tears, you got symptoms that show up on physical exam. We see that we have persistent pain despite non-operative treatments. We have pathological changes seen on X-ray or MRI, those kind of things. But really, with somebody who comes to see us, they don't want to get surgery. They have a tear in their meniscus and they don't want to go through the surgery, an ACL tear. Those are the kind of things that we can do with PRP to help out with. Who's used it? I was watching Hines Ward back, this was back some years ago, in the conference championship. He's running down the sideline and boom, gets his knee taken out. Had some tears in his knee. They won the game, so they're going to the Super Bowl. They were expecting him to be out, but what does he do? He gets PRP, plays in the Super Bowl, and they win. Amazing, amazing stuff. Any adverse reactions? No, not really. The biggest adverse reaction is going to be just because of injection at the injection site. That seems to be the thing that if anything goes on, of course, there's blood clotting risks or bleeding risks or infection and those kind of things that go on with any sort of injection, but nothing really a problem or adverse with it. Contraindications, yes. If somebody's on a high-dose blood thinner like Plavix or Coumadin or warfarin, we've got to get with your doctor about that and see if we can do it. So that's an important thing to note. PRP is FDA approved. They are doing extensive research on it. How long does it last? Well, if we really get that working and get your body functioning better, it should be pretty good. It should theoretically be permanent. Just that we don't aggravate the injury or have that major degenerative condition. And PRP can't be repeated many, many times safely. So PRP is a great, great regenerative measure that we can do. Now we get into the stem cell work, and that is, I'll tell you, it's stem cell, but the really thing, what the tissue is. There's two types: the cryopreserved amniotic membrane allograft. Cryopreserved, what does that mean? It means it's basically frozen. Amniotic membrane, where's that from? That's from the amniotic membrane of a woman who's having a baby, right? An allograft means it's from somebody else. So we're getting this tissue from amniotic membrane from a willing participant, okay? This isn't Planned Parenthood or anything like that. So make sure you understand that. That is not where we get this type of tissue from. These people are screened. They are we are made sure that it is very clean tissue. It is from all C-sectioned ladies, because it is then sterile tissue, which is great. So that is the cryopreserved amniotic membrane allograft. It contains high levels of growth factor. There's a lot of scaffolding, cytokines, natural hyaluronic acid, and there are stem cells in there. There's moderates in there. They don't really give us a whole lot of information back. The banks, the tissue bankers, they don't give us a whole lot of information back on the amounts in amniotic. Some say there's none, some say there's some. So you just have to know that this stuff, we started off doing a lot of amniotic, but found out that the umbilical cord had really high levels. So I'm going to tell you about that in a second. But the amniotic membrane does work very well, especially for people who do have degenerative disease in their joints. So really helps to reduce pain and elimination and reducing inflammation, and minimizes scar tissue and promotes that soft tissue growth. This is the gold standard of the regenerative medicine. That is the umbilical cord, that membrane, plus the amniotic membrane in an allograft. So if we can get it from an umbilical cord, this has the highest count of stem cells. Okay, you're going to have anywhere between 700,000 to 1.5 million cells in 1 cc or 1 milliliter of this tissue. Okay, I'm going to compare this because some people, they go, well, what if I got stem cells from myself? And you can get stem cells from yourself. Dr. Sutherland actually even does some of that. That's usually through what's called a bone marrow aspirate, BMA. So on a bone marrow aspirate, where are they getting that tissue from? Right? Your bone marrow. So what do they have to do? They have to get to your bone marrow, which means they're going in generally through your pelvis, and they're going to take this big needle, they're going to stick it in there, and they're going to start scraping stuff off. In 1 cc of that, guess how much stem cell you're going to get out of there? Anywhere from 5,000 to 7,500 cells in 1 cc versus the umbilical cord amniotic, which is going to give you 700,000 to 1.5 million cells. Big difference. Big difference. Again, lots of cytokines and natural hyaluronic acid all involved in here. This is the gold standard of care. The source, like I said, comes from exclusively accredited scientific companies, tissue bankers they're called. Of course, they're getting this from somebody else, right? So they're harvested from willing and uncompensated donors. These are parents of live birth cesarean sections. Prior to donation, their health is rigorously screened, and only those who pass the screening are allowed to donate. The stem cells are then carefully processed by the licensing professionals, and a sample from every donor is kept on file by the harvesting company and the FDA. All the tissues obtained are screened under the AATB, which is the American Association of Tissue Banks, in order to assure the highest quality product. Stem cells are shipped and received cryogenically to ensure the integrity of the cells. Basically, in the United States, we have the ability then, we thaw them, we inject them. You cannot do anything more with those type of cells. It is against the law to do any sort of growth of them or anything like that. They are just injected into the tissue. Okay, you can go overseas and you can do that. You can harvest your own and do all those kind of things, and $50,000-$75,000 later, that's what you get. You know, it's a huge investment, but for some people that may be worth it. That's what they want to do. Great, you know. But we do have the ability to do it here for a much less amount in terms of financial outpour than 50 to 75,000. So important to know the source of these things. These things are, like I said, not Planned Parenthood. These cells are also what are called immune privileged. Okay, so I want you to know that, because some people will ask me, do they do these, you're putting in some tissue from somebody else, could I have a reaction to that? And like if you've got a heart transplant, man, you got to go all through kinds of different drugs to stop any rejection factor, because your body would look at that and go, oh, that's foreign, 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 attack. And so with these cells, that doesn't happen. It doesn't happen because there are no antigens on the cell. Okay, on the adult tissue, you have a lot of antigen on it. On this tissue, there is no antigen on it, so you can inject it and it freely works. One of our tissue bankers, 40,000 units of this stuff went out just last year alone. Not one adverse reaction. If there were adverse reactions to this stuff, it wouldn't be allowed. I'm telling you, just wouldn't be allowed. Here's some pictures of before and after. You can see the differences in the spacing of the knees that go on there. Unbelievable. This is a combined PRP and stem cell. This patient had hyaluronic acid injections but didn't get really good improvement. We did the combination care, which I believe is the best care you can get, the PRP along with the stem cells to really make sure of good change. So this is an 88-year-old, stem cell PRP in September, PRP in October, and PRP again in November. PRP is a 3-injection series. And so really great change. So our goal is not only to help you get out of pain, but get you back to function, stop that degeneration, and help you regenerate. That is the truly amazing thing about this and this tissue and how it works. It can really make substantial changes to your life. And how are we different? Well, we talked about that with the fuel, form, and function. We don't want to just inject you and go, because I've seen that a lot, and those people actually come back into me because they're hurting. Because that person did not get changes to the way their body functions, which they could feel better for a little while, but then tends to get worse. So I want to make sure you understand that if you don't change the way you fuel your body, the way your form is, that alignment issue, and the way your body functions through its nervous system, is that the likelihood of these things working goes down. You might get good results from just getting an injection, but if you don't fix the actual problem that brought it on, you have a good possibility of going right back. So don't want that for you. Lots of cogs in the wheel. We want to make sure that we're making all the changes that we can to those different aspects, so that way you get the best results and things work properly and smoothly. Again, here's your kind of list of different aspects of care: over-the-counter drugs, prescription drugs, steroid drugs, the gel or the hyaluronic acid, PRP, platelet-rich plasma, right? The different allografts, and the allograft with PRP is your best result. So price, everybody wants to know price of these things, and it is vital, so that way you understand what kind of pricing we're looking at, because when we get into it, is some things are covered and some things are not. Insurance does cover some things, but they don't cover other things, so let's talk about that. Hyaluronic acid injections generally covered by Medicare and most medical insurances. The medical office visits that we would have in our office, covered. PT, generally covered. Chiropractic, generally covered. Those things with that, if somebody needs hyaluronic acid injections, are generally covered. All right, so I want you to know that. And when it comes to platelet-rich plasma, this is a non-covered thing by Medicare and most major medical. $1,500 is what it costs for the platelet-rich plasma. That is a 3-injection series, and those 3 injections total $1,500. For listening to this, we're going to give you 20% off it. Again, all your medical visits, PT, chiropractic, is generally covered by insurance. So PRP is an option for a lot of people and can be a good one. The cryopreserved amniotic membrane, this is not covered also. Amniotic is $3,800 in our office. That is a single injection. Seminar Special is getting 20% off. All right. All medical visits and PT and chiropractic generally covered. One of the things that one of the companies that gives us our amniotic membrane allograft, they came into our office and they saw what we did and they said, wow, we love how you do this and how you do things here, is we're going to back you up by, we're going to give you a follow-up injection for that patient absolutely free. I was blown away. Blown away. They're given $3,800. Now, this isn't a second joint. This is a follow-up for that joint. Okay? So if you have two knees, that's 3,800 times 2, but you're going to get a follow-up times 2. Okay? So just to be very, very clear, that is that company will do that for us, which is unbelievable. It's great stuff. One usually does the trick. Two, even better. The gold standard, the cryopreserved umbilical cord plus the amniotic membrane, is not covered. That's $6,000 a joint. Additional joints are only $3,000. So if you do one joint and have another joint, you need to be done. The second joint is only $3,000. Okay, and so that's important to know, because if I buy in bulk, they give me reduction on that stuff. All right, so it is 20% off. So the first unit is really only $4,700. We do have intravenous therapy. Intravenous therapy is especially good for those people who have more autoimmune type of things, all kinds of that kind of stuff. However, we don't like to really go out there and talk about that too much. We like to do it as a wellness thing. You can see a lot of that stuff overseas. They do things like that. So for us, we look at it as improving your overall health. And people that have multiple things that are going on, it can boost their overall health and function, which is great. Again, medical, business, PT, chiropractic is generally covered. Some people say, man, I can't afford that. Well, want you to, one, get that out of your head, because there's so many things that are available for you in terms of different types of financing and those kind of things. If you need that, we do some in-house, we do some out-of-house. There's all kinds of things we can do, okay? The first thing is we need to know what's going on with you, so that way we can create a flexible payment option that fits you, okay? So we got to make sure of that. So I want to help you and give you a precious gift, and that is to help you to live longer and happier and healthier. That's what we do. We want to help people do that. Okay, so the next step is our facility. We offer a risk-free consultation. You can come in, talk to one of our staff members, go through and see if you are a potential candidate. You'll get a tour. You're going to see what's going on there. If you want to move forward and you want to receive the exam and any x-rays that are necessary, that's usually going to be anywhere from $200 to $300. So $250. You're going to get that for only $47. Okay, that is something you can do. We want you to see what is going on there with you. Okay, if for some reason your insurance is even better than the $47, which I guess it could be, then you'll pay the lesser. If it's more, then you're paying $47. It's risk-free for you. Let's see what's going on. The biggest thing is we don't want to waste your time and your money. All right, I want to make sure you know that. Is if we can help you, we're gonna talk about that, and we're gonna get you on that path. If we can't, we're gonna get you to where you need to go. Okay. Please make an appointment with my assistant, and you can leave a message here, and you can make an appointment right through this portal here with our assistants, and they can help you to help really change your life. Okay. So very, very important. I want to make sure that you understand that we have that help for you. That basically that $200 off there that you're getting on that for that appointment is huge. If you want to take advantage and just schedule up a consultation, we can do that with you. Just click there and get that going. I hope that you learned a whole lot here. If you have any other questions, definitely talk to one of our assistants. They can get you with us and hopefully answer those questions to the best of our ability. If you want to come in and do a in-person live presentation of this, we do those generally once or twice a month at a local restaurant here in McKinney, Texas. So we'd love to see you there. you can call and inquire about that also. So I hope you had an enjoyable time and that you got a lot out of this, and we look forward to helping you out and getting you back on that path to health and regenerating those joints. All right. Have a great one. Thank you.